Hello, anatomy students. Today we are going to review the bones of the pectoral girdle and the upper extremity, the arm. And so you might be wondering, why are you standing on a desk and looking down on our skeleton? See, there's the top of his head. Well, I'm doing this because I want to show you what a girdle is. A girdle is simply a ring of bone that's surrounding other structures. So if you take a look, this is the top view. Here's rib number 1, rib number 2. And you can see that we have this ring of bone that's surrounding the thoracic cage. So anteriorly, we have the clavicle, and that is articulating with a portion of our scapula. Now, this doesn't look like the scapula that you're familiar with because we're looking at it from the top down. But I'll show you another view right now. Just try not to fall. Here we are. And so here's the posterior aspect of the skeleton, and then here, of course, is the scapula. So as we look then at the anterior view of our skeleton, this is one of the clavicles. This is the right clavicle. And then, of course, we have the one also that's on the left. And as I said, it's going to articulate laterally with a portion of the scapula. So let's take a look, first of all, at what the clavicle looks like on its own. And so here's a picture of the clavicle itself. It has this wave-like shape, and the portion that articulates with the sternum is a little bit chunkier, and the portion that articulates with the scapula is a little bit thinner, not quite as thick. So this is our clavicle. So the clavicle was the first part of the pectoral girdle to know, and the part that sits on the posterior aspect of the thoracic cage is the scapula, which is what we are looking at here. This is the left scapula, and this is the right scapula. And I'm sure that many of you are saying, wait a minute, I thought you said that it's always the patient's left and the patient's right and not ours. Well, that is true, but we are looking at the posterior aspect of the scapula, and so the right and the left are the same on us as they are on the patient. So if I were to turn my skeleton around and have you look at him from the back, this is the right side, and this is the left side. And while I've got you here, I just want to show you, I'll show you on just one of them here, that this is the posterior side of the scapula. Notice that we have this ridge of bone here. This ridge of bone is called the spine of the scapula, and that's how you know if you're looking at the posterior aspect of the scapula or at the anterior aspect of the scapula. You see, the posterior side has that ridge of bone called the spine of the scapula right here. But if we look at the anterior side, it's completely smooth, and that's to allow it to sit nice and flush and even with the posterior aspect of the thoracic cage, to sit nice and even on top of the ribs in the back. So the spine of the scapula is simply this ridge of bone. You have different muscles that are going to fill in here and up here. But for your purposes, you need to know that the spine of the scapula is going to give way to this large bony protrusion. This is called the acromion process. The acromion process. And the acromion process, along with this other anterior process called the coracoid process. Now you've got to be careful with the spelling on that in the practical, because spelling counts for this one. It's coracoid with a C, coracoid process. So our acromion process, our coracoid process, and our glenoid fossa here, this is all going to create the socket where our humerus, where our upper arm bone is going to articulate. Okay, 2 more things to know about the scapula. You need to know about the borders. You need to be able to identify the borders or the edges. So if the humerus, if the arm is attaching here on this side, this must be the lateral aspect of the scapula. And indeed it is. This is called the lateral border or the axillary border, because this is the edge of the bone that is closest to the armpit region, which is also known as the axillary region. On the other side, the side that's closest to the vertebral column, this is called the vertebral border or the medial border, because it's found on the more medial aspect of the body. Okay, so let's go over these parts again. So this whole bone is called the scapula. This is the spine of the scapula, which gives way to the acromion process. Here we have the glenoid fossa. And then on the anterior aspect, we have another process called the coracoid process. You need to know the 2 edges of the scapula itself. And the first edge is on the same side as the glenoid fossa, which is where the arm is going to be. This is the axillary border or the lateral border. And opposite that, we have the medial border or the vertebral border. So that is all that you need to know about the scapula. So by talking about the scapula and the clavicle, we've talked about the pectoral girdle. Now we're going to move on and talk about the upper limb. This portion of the upper limb is called the arm, and the lower portion down here, this is called the forearm. So let's focus on the one bone that forms our upper arm, which is the humerus. And so I just wanted to point out to you that here on the skeleton, you can see that the top portion of the humerus articulates with the glenoid fossa. And this is the armpit, right? This is the area right in here where you would put your deodorant. And so this is the axillary region. And so once again, this is the axillary or lateral border of the scapula. And then on this side, we have the medial, because it's closer to the middle of the body, or the vertebral border of the scapula. Okay, enough of that. On to the humerus. So the humerus at the proximal end has this rounded out portion, which is called the head, and that articulates again with the glenoid fossa of our scapula. And then there are a couple of other landmarks that I want to go over at the proximal end. But the other thing that I wanted to mention, since we're looking at the whole skeleton, is if we look at the distal end of the humerus, you'll see that it's forming a joint with one of the forearm bones. This joint is your elbow joint. And I just want you to keep this in mind, especially when we get to the distal end of the humerus, that the process, like this chunky part of the bone, the process of this forearm bone fits right into the ditch that we have on the posterior aspect of the humerus. And it's just going to glide along a track in order to form that elbow joint. But the other thing is that there's even a way that these bones fit together on the anterior side. So here, once again, we have a little bony process on the forearm bone. And as we bend that elbow, you can see that it's going to fit right into this little ditch on the humerus. And notice that it's running along this track. Well, all of these ditches and processes and tracks, they all have names that you're going to need to know, but I just wanted you to have that in your head as we started talking about the humerus. So here's the humerus on its own, and one thing that you need to do when you are starting to identify structures on the humerus is you need to figure out, are you looking at the anterior side of the humerus or are you looking at the posterior side of the humerus? So here are a couple of things to keep in mind. I think that the main way that you can tell whether you're looking at the anterior side or at the posterior side is by looking at the distal end, the end that's opposite this large rounded head portion. Look at the distal end. If you have another very round chunk of bone with a tiny hole, then you are looking at the anterior side of the humerus. If you don't have that rounded marble-like chunk of bone and you have a very large hole, like one that your thumb can just fit into, you're looking at the posterior aspect of the humerus. And the reason why it matters is because you can see different structures from different sides of the bone. So I wanted to make sure that you knew how to do that. So we're going to start with the anterior aspect of the humerus. And the very first thing, I'm going to start at the proximal end. And I know that this is proximal because this is the part that's going to attach to the axial skeleton. That's this rounded part here, which is called the head of the humerus. The head. The head is attached to the rest of the bone by this like little indentation, this little ridge that runs along right underneath the head. This is called the anatomical neck. This is different from the surgical neck because the surgical neck is a little bit lower. It's right like the border between like the epiphysis and the diaphysis of the humerus. This is called the surgical neck because this is where this bone is most often broken. Now, two other landmarks that you need to know from this view are the tubercles. There are two tubercles. The one that is more lateral is the greater tubercle, and the one that is more medial is called the lesser tubercle. And if you look at them, if you were to turn the bone, the one that sits a little bit higher is the greater tubercle, and then the one that sits a little bit lower is the lesser tubercle. So those are the two tubercles. The next thing to know is that there's this ridge of bone right along here. This is where one of your muscles is going to insert to allow you to do arm circles and things like that. This is called the deltoid tuberosity. The deltoid tuberosity. So your deltoid muscle is going to insert right along here on the humerus. All right, moving down to the distal portion of our humerus, there are a few structures to know. The first thing that I want to talk about are the epicondyles. We have a medial epicondyle and we have a lateral epicondyle. Now, a condyle is simply a rounded portion of bone, but this is an epicondyle, and the prefix epi means on top of. So this is a bump, a condyle-like bump that is above the end of the bone. Now, one thing to remember, wherever the head is, that is automatically the medial side of the humerus because the head has to click in to the rest of the body. So the head is always medial, which means that this bump right here, being above the bottom of the bone, this is the medial epicondyle because it's on the same side as the head. Opposite that, over here, we have the lateral epicondyle. The little ditch that you see here, the small hole, it's like my pinky can maybe fit, like the tip of my pinky can maybe fit in there, but it's very small. This is called the coronoid fossa. Remember that all little ditches are fossas. And this round marble looking like chunk of bone, this is called the capitulum. Finally, we have this saddle looking like structure. This is called the trochlea. The trochlea. Okay, let's review what we've seen on the anterior view of our humerus. So, this rounded portion is the head. It's connected to the rest of the epiphysis by the anatomical neck, and the surgical neck is where the epiphysis joins the diaphysis. We have two bumps to know. We have the greater tubercle and the lesser tubercle. And the ridge of bone that runs right down here is called the deltoid tuberosity. At the distal end of the anterior side of the humerus, we have two epicondyles. This is the medial epicondyle. How do I know that? Because it's on the same side as the head, and the head is always medial. We also have the lateral epicondyle, the coronoid fossa, the capitulum, and the trochlea. Let's flip the bone over so that we're looking at the posterior side. Now, as I said, the posterior side has this very large hole, so that's how you know that you're looking at the back. But from this view, you can see still the head very well, the anatomical neck, and of course the surgical neck will be in the very same place. On the distal end of the bone, we have our medial epicondyle, and I know again that this is medial because it's on the same side as the head. I have the lateral epicondyle. I have the trochlea. I can still see it from the back. And then this large ditch is called the olecranon fossa. The olecranon fossa. All right, those are the parts of the posterior aspect of the humerus. I hope you enjoyed this video and that you learned a lot. Talk to you in class. Bye now.